Hello, my name is Stacia and I am here to discuss the 2021 Salmonella outbreak linked to frozen breaded stuffed chicken products. In 2021, the United States experienced an outbreak of salmonella infections linked to frozen breaded chicken products, resulting in 36 illnesses and 12 hospitalizations across 11 states. Through the investigation, the CDC highlighted that many consumers were unaware that these products required thorough cooking to eliminate harmful bacteria. This outbreak emphasized the critical importance of food safety and proper poultry handling in home kitchens. Investigations aimed at tracing the source of the contamination uncovered lapses in food handling practices, leading to calls for better consumer education and awareness. Regulatory agencies and manufacturers were prompted to reassess their food safety protocols, resulting in enhanced guidelines for freezing and cooking poultry products. Ultimately, the incident highlighted and shared responsibility among consumers, retailers, and producers in safeguarding the food supply and ensuring public health. Establishing the existence of an outbreak is essential for mobilizing public health resources. In the 2021 Salmonella outbreak linked to frozen stuffed breaded chicken products, the CDC's initial step involved analyzing reported illness cases across multiple states, all of whom exhibited symptoms such as diarrhea, fever, and abdominal cramps. Health officials noted a significant rise in salmonella infections, thus prompting further investigation. In the second step, the CDC prepared for field work by assembling a multidisciplinary team of experts, including epidemiologists and food safety specialists. They reviewed preliminary data, focusing on case patterns and demographics, refining their hypothesis, and developing an investigation plan. The team identified key stakeholders such as local health departments and affected manufacturers to facilitate collaboration. They also planned interviews with affected individuals to gather information about food consumption and collect samples from stores and households. In the third step, the focus was on verifying reported cases. Public health officials worked with clinical laboratories to confirm that the illnesses were caused by salmonella, with about 70% of the cases linked to the same genetic variant. Case definitions ensured that only individuals meeting specific criteria were counted in the outbreak, establishing a clear link to the products produced by Serenade Foods from Milford, Indiana. This verification helped identify the source of contamination and guided public health interventions. The fourth step involves defining and identifying cases by creating a case definition that specified both clinical and epidemiological criteria. Public health officials use this definition to systematically identify affected individuals and gather data through interviews and medical records. This rigorous process was crucial for understanding the outbreak scope and implementing effective interventions like recalls and public advisories. Step 5. The CDC used descriptive epidemiology to analyze case data, examining factors such as age, sex, and geographic location. They constructed an epidemic curve to visualize the outbreak progression, thus identifying peaks linked to the distribution of contaminated products. The analysis revealed that 83% of the affected individuals reported consuming frozen stuffed chicken prior to falling ill. This information was vital for determining outbreak sources, enhancing understanding, and guiding future studies. In the sixth step of the CDC investigation, investigators focused on formulating a strong hypothesis about source and transmission of the outbreak. They utilized data showing 83% of affected individuals reporting consuming frozen stuffed chicken products and identified the specific strain as Salmonella interdictus. Key factors such as food handling practices and hygiene lapse at production facilities were analyzed. Genetic sequencing revealed that 90% of tested samples shared the same genetic fingerprint, establishing a clear link between the cases. This solid hypothesis directed further investigations and targeted interventions to safeguard public health. In this step, the focus shifted to evaluate the hypothesis through analytical studies. Investigators conducted case control study comparing food consumptions of affected individuals with those of uninfected individuals. They assessed whether there was a significant association between specific brands such as Dutch Farms, Kirkwood, or Milford Valley and the reported salmonella infections. Environmental assessments at Serenade facilities helped identify lapses in food safety practices. Findings were cross-referenced with genetic data confirming the outbreak's source and guiding public health interventions. In the eighth step, investigators refined hypotheses based on new data. Initial evidence indicated Serenade's foods as a source, but later findings implicated additional factors such as an 85% increase in consumer handling errors and cross-contamination in 40% of the households. This iterative refinement was vital for accurately targeting public health interventions aimed at preventing future outbreaks. Step 9. Implementing control and preventative measures. The CDC focused on implementing controls to reduce further infections. After identifying the source as poultry products from the Serenade manufacturer, they worked with food safety regulators and distributors to enforce food safety protocols. Actions include recalling over 60,000 pounds of affected product and issuing public safety advisories for handling practices. Educational campaigns also emphasize cooking poultry to at least 165 degrees Fahrenheit. These measures aim to address the outbreak and establish a framework for preventing future incidents. In the final phase of an investigation, the CDC released reports detailing source contamination traced back to Milford, Indiana, Serenade manufacturing facility. The CDC outlined the outbreaks and response measures, including recalls of thousands of pounds of affected frozen stuffed breaded chicken products. These findings were communicated through press releases and public health advisories, ensuring that the public and food industry were informed of the risk. The CDC's swift response raised awareness, limited illness, and prompted changes in food handling practices.